Welcome back, everyone. Brandon Fischer is with us today, Allen County's Health Commissioner. We were talking a little bit before we came on about COVID situation, and we talked about the Omicron variant, which is sweeping the nation. We assumed it was here, and we kind of got confirmation on that then.
Yeah, we got confirmation earlier this week in genetic sequencing that took place that we had 6 confirmed Omicron variants in positive tests that took place. The problem with genetic sequencing is it takes several weeks. So those Omicron variant cases that we found were from late December into early January. So we utilized kind of the increase in cases to determine what the spread of Omicron was in this area, and used Cleveland as our leading example to determine that.
You bring up a very good point, because to determine our future, sometimes we look at those places where it hit first. Is there a glimmer of hope in that things are starting to die down on the other side of the state?
On the other side of the state, they're starting to see their cases drop. They're starting to see their positivity drop. We've been about 2 to 4 weeks behind the Cleveland area. So the next couple weeks could still be pretty painful for us. And just because you get infection with COVID and Omicron variant may not be as severe, it does not mean that it's less severe for you if you get that infection. So best advice we have to people is just remain vigilant, wear the mask, and if you're exposed, just keep an eye out for those symptoms.
From what you see in the data, and I know you keep close track of this, so the Omicron was a variant of it, do we get the sense there will be other variants? And if so, that come through, do we get the sense that each one will be less severe?
The hope is whatever variant comes after Omicron is going to be less severe.
Right.
We're not aware of any new variants coming down the road, but with Omicron, it was something that we heard about Thanksgiving weekend, and it swept across the globe.
Sure.
So we hope that other nations are as vigilant as we are with looking out for some of these variants to give us enough warning so that we can identify what necessary steps need to be taken to avoid the next wave of COVID.
Yeah, and it sounds like from what we're hearing from the White House and on the state level, more opportunities to get masks and more opportunities to get testing over the next couple of weeks too, right?
Yep, over the next couple of weeks, you'll be able to order the test from covidtest.gov. You can also get COVID tests from pharmacies, and those are covered, reimbursable through your health insurance plan. So there's the opportunity to get those rapid tests. If you do need a PCR test, best advice we have is just to reach out to your primary care provider. They can write you an order, and it can get you in and get you tested. With testing over the past 2 years, it ebbs and flows, but you can get test results within 48 hours on some of those PCR tests, and sometimes faster.
And I know the hospitals locally have had press conferences too, begging people to say, hey, if you're going to get, if you need to get tested, either do it at home or go to an urgent clinic and try to not clog up the ERs if you can help it, right?
Correct. The best place to go is to do those home tests if you have them, or go to an urgent care and get that test at the urgent care so that you're not clogging up the ER for those other patients that are coming in with broken legs or car accidents that need that treatment there. So if you can get to an urgent care, get to an urgent care to get that test.
And I know there are some people out there that still don't get the vaccine for whatever reason, but the stats don't lie in what we're seeing at the hospital as far as the sickest cases and those that are on ventilators, right?
Correct. The hospitalizations, vast majority, 80 to 90% of people that are in the hospital are unvaccinated. The vaccine provides that protection from severe infection and death. And in the ICU, those numbers jump even higher, where it's 95% of the people that are in the ICU are unvaccinated. And maybe that 5% is someone who had immune compromise, who we advise to take additional steps beyond getting vaccinated to protect themselves from infection, severe disease, and death.
Yeah, and as you said, the advice that you'd given 2 years ago when this first came out is still, a lot of it's, the core principle is still the same, right, as far as staying safe?
Yeah, the best advice that we can give is if you don't feel well, stay home.
Right.
If you can get a test to confirm whether it's COVID or not, that's a bonus. But if you don't feel well, stay home, stay away from others, wash your hands, and then just be on the lookout. If those symptoms get more severe, contact your primary care provider, and they can get you potential treatments to protect you from further downgraded
problems down the road. Yeah. All right. Good advice as always. Thank you, Brandon.
Yep,
we appreciate
thank you.
it. Good seeing you. Don't go away. More medical news coming up next on